How to get rid of male candidiasis permanently. I'm Dr. Petronio Melo, a urologist, and today I want to talk about a problem that often causes a lot of discomfort and even embarrassment in men, but which can be treated: candidiasis. Although many people associate candidiasis only with women, men can also be affected by the excessive growth of the Candida fungus, mainly on the glands and foreskin, leading to what is known as Balanitis. This can happen at any age, whether in adolescents or adults. It usually causes redness, itching, burning, and whitish scaling in the area. The good news is that there are effective ways to deal with this problem, from simple hygiene measures to definitive treatments. First of all, it is important to understand that Candida normally lives in our bodies, mainly in moist and warm areas such as skin folds. The problem occurs when something unbalances this environment, allowing the fungus to grow excessively. Factors such as high humidity, lack of proper hygiene, prolonged use of antibiotics, weakened immune systems, and even poorly controlled diabetes can contribute to the proliferation of Candida. Therefore, if you have noticed symptoms such as constant itching, a burning sensation, and whitish patches on the glands or foreskin, it is very likely that you are dealing with candidiasis. In this case, it is essential to consult a specialist as soon as possible because if the infection is not treated, the area can become even more irritated, paving the way for complications. One thing that often goes unnoticed is that candidiasis can manifest itself in a mild form with simple discomfort or the appearance of redness. Some men end up ignoring this initial discomfort or trying to self-medicate without guidance, which can worsen the condition or cause the infection to become recurrent. In addition, if there is a sexual partner, it is possible that the person is also infected and needs treatment to avoid this back and forth of fungi that perpetuates the problem. Therefore, it is important to talk openly with your urologist to determine whether joint treatment is necessary. The first step usually involves antifungal medications, which can be creams or tablets. These medications generally act directly against the fungus, relieving symptoms and helping to restore the skin's natural balance. At the same time, it is essential to adopt proper hygiene, preferably using water and mild soap, in addition to drying the area well. Excess moisture is an invitation for the fungus to proliferate, so extra care after bathing should be taken, especially if you have a long foreskin, which can retain even more moisture. It is also important to change your underwear every day and choose fabrics that allow ventilation, such as cotton. Sometimes, candidiasis is associated with episodes of phimosis or paraphimosis, in which the foreskin becomes tight or makes it difficult to fully expose the glands. This contributes to the accumulation of secretions, creating a perfect environment for fungal growth. In these situations, even if you improve with the use of creams and pills, there is a greater risk of the infection returning in a short time because the anatomical factor that facilitates the proliferation of Candida has not yet been resolved. This is where postectomy comes in as a possible definitive solution. By removing the excess foreskin, hygiene becomes much easier, considerably reducing the retained moisture. In this way, the fungus loses its favorable environment and infections tend to disappear. Of course, this is a surgical procedure and should not be taken lightly. Recovery, however, is usually relatively smooth, as long as the care recommended by the surgeon is followed. Some men are concerned that their penis will become less sensitive after circumcision, but in most cases, the adaptation is good and there is no negative impact on their sex life. Furthermore, the decrease in the frequency of balanitis or candidiasis generally outweighs any initial postoperative discomfort. It is essential to talk to your doctor to assess whether this procedure makes sense in your specific case. Sometimes the problem can be resolved with local treatment alone, but if the infections recur and affect your quality of life, a postectomy may be the definitive solution. For many people, the decision to undergo this type of surgery is fraught with doubts and insecurities. It is therefore important to understand the benefits and risks involved. If you have already tried antifungal medications and felt temporary improvement, but the infection soon returned, it is worth considering the possibility that the primary cause is linked to the difficulty in cleaning the glands due to a very tight foreskin or an adhesion that prevents the skin from retracting properly. In this scenario, continuing to apply ointments alone can become a real vicious cycle. Postectomy breaks this cycle by facilitating access to the region, improving daily cleaning. With the region more exposed and less moist, the Candida finds a less favorable environment, and this usually resolves the problem in a lasting way. It is also worth mentioning that maintaining a healthy lifestyle makes a difference in preventing new infections. Candida can take advantage of imbalances in the body, so taking care of your diet, avoiding excess sugar, controlling your weight, and properly treating diseases such as diabetes can help prevent these symptoms from recurring. If the fungus always finds itself in a weakened organism or in a humid environment, it will multiply more easily. Therefore, adopting healthy habits combined with medical treatment is the most complete formula for those who really want to overcome male candidiasis. If you are suffering from recurring infections or suspect that your foreskin may be the cause, do not hesitate to seek specialized help. Sometimes a detailed clinical examination is enough to determine the best treatment and put an end to the problem once and for all. I provide in-person consultations in Sao Paulo, the capital, and also online for those in other regions or even other countries. It will be a pleasure to learn about your case and provide personalized guidance, whether to recommend local treatment or, if necessary, to evaluate the option of postectomy. The important thing is not to suffer in silence, as there are resources available to resolve male candidiasis permanently. I hope this video has helped you understand why male candidiasis appears, how it can be treated, and, most importantly, what role a postectomy plays in preventing recurrent cases. If you liked this content, share it with anyone who needs this information. Many people still think that candidiasis is something that only happens to women and, because of this, delay seeking help, which only makes the discomfort worse. So, let's spread this knowledge so that more men know how to identify and treat candidiasis correctly. Thank you very much for staying with me this far. Take good care of yourself, and until the next video, God bless you.